The molecular fundamentals of immunotherapy. There are 4 groups of causes of immune disorders that determine the appearance of new diseases and change the course of old ones. Looking of natural selection, which took place on the basis of resistance to infection and for thousands of years has improved the immune system, maintaining its working order. Wide and often unjustified use of antibiotics by inhibiting the growth of pathogenic microbes. Antibiotics reduce the amount of antigens that stimulate the immune system. Influence of environmentally unfavorable factors. Psycho-emotional stress. The coming century could be the century of opportunistic infections due to the ever-increasing influence of environmental factors on the body and the immune system. The number of diseases accompanied by secondary immunodeficiency continue to grow. In connection with the above, the use of immunotropic drugs in the treatment of infection diseases is of the greatest importance. The methods of immunotarget therapy existing today can be divided into active-specific vaccination, non-specific adjuvant, including cytokines and their inducers, drugs of microbial origin, and synthetic substances. Passive-specific immunotherapy involves the use of monoclonal antibodies and enriched immunoglobulins. Non-specific, normal standard immunoglobulins and interferons. Classification of modern methods of immunoglobulin therapy. Active immunotropic treatment. First, specific are vaccines and lymphocyte-activated lymphocytes. Second, non-specific therapy adjuvant are cytokines and non-cytokine adjuvants, immunomodulators of microbial origin, inducers of cytokines, thermic peptides, synthetic substances. Passive immunotropic therapy. First, specific monoclonal antibodies, enriched immunoglobulins. Non-specific, normal immunoglobulins, cytokines with effector action. The main criteria for use of modern methods of immune-focused therapy are advice-based medicine methods, including multi-centered, randomized, and placebo-controlled trials. Immunomodulatory drugs are interferon preparations, interferon alpha preparations, egiferon, reaferon, intron A, realdiron, roaferon, welferon, interferon beta preparations, Rebif, ferron, fron, beta-ferron, interferon gamma preparations, mega-D gamma interferon, gamma interferon recombinant. Mechanism of action. Viral antiviral. Increase the number of HLA molecules for various types of cells and enhance the function of antigen-presenting macrophages. Stimulate the activity of natural killer cells. Increase mobility digesting activity of macrophages. Increase the synthesis of antibodies. General indication for appointment. 1. Disease of viral etiology. Severe viral infections as influenza, adenovirus, enterovirus, herpes, mumps. Acute, recurrent, and chronic keratoconjunctivitis caused by adenovirus, herpes virus. Viral, bacterial, and mycoplasma meningoencephalitis. Genital infections. Shigellose, laryngeal papillomatosis, squamous and genital warts, acute viral hepatitis B, several forms, chronic hepatitis B, chronic hepatitis C, HIV infection. 2. Some malignant neoplasms, melanoma, non-Hodgkin lymphomas, osteosarcoma, breast cancer, squamous cell skin cancer, basal cell skin cancer, renal and bladder carcinoma. Interferon preparations for topical use. 1. Human leukocyte interferon, nasal drops, eye drops, suppositories. For acute respiratory viral infection prevention, 1 ampoule of interferon for nasal use is diluted in 2 ml of boiled water and still 5 drops into each nasal passage 2 or 5 times a day. Use as long as the risk of interferon remains. The treatment of acute respiratory viral infections instill 5 drops in each nasal passage. You can use aerosol. The contents of the ampoule are dissolved in 10 ml of water. 2 ampoules are used per session. The frequency of inhalations is 2 per day. Referrals, suppositories, ointment, complex preparation including recombinant interferon 2 beta, vitamin E, ascorbic acid. In the treatment of newborns and children under 7 years old, Interferon 1 150,000 international units is used for children over 7 years old and adults. Interferon 2 half million international units and Interferon 3 1 million international units. The drug is genetically engineered and is not a blood product. Initial course 1 candle each 2 rebels per day, each 5 or 10 days. Supportive therapy 1 suppository 2 times a day, 3 times a week from 1 to 12 months. Indications for use: acute respiratory viral infections, pneumonia, meningitis, sepsis, chlamydia, herpes, cytomegalovirus infection, rare plasmosis, mycoplasmosis in newborns including premature babies. Acute respiratory virus, pyelonephritis, bronchopneumonia, non-specific lung disease, urogenital infections in pregnant women, acute and chronic viral hepatitis B, C in children and adults. Prevention and treatment of postoperative purulent complications. Parotitis, herpes, chlamydia, cytomegalovirus infection, ureaplasmosis in children and adults. Virus-associated glomerulonephritis in children. Complex therapy of prostatitis, endometriosis, and chronic vulvovaginitis. Dysbacteriosis in children and adults. Juvenile rheumatoid arthritis. Interleukin preparations. Oncoleukin recombinant human interleukin 2. Method of application: intravenous drip from 1 to 2 million international units in 400 ml of isotonic natrium chloridum solution, 2-3 injections with a break of 3 days. Mechanism of action: stimulates proliferation, differentiation, activation of T killers, natural killers, and beneficiates. Strengthened antibacterial, antiviral, antifungal, antitumor immunity. Indications for use: post-traumatic surgical, obstetric and gynecological burn, wound, sepsis. Acute destructive peritonitis, osteomyelitis, endometritis, sinusitis, abscess, phlegon, chronic hepatitis C, surface and systemic mycosis, herpes, chlamydia, melanoma, bladder cancer, colorectal cancer. Beta-leukin, recombinant human interleukin 1 preparation. Method of application: intravenous drip at 2 nanograms per kilogram in 500 ml isotonic natrium chloride solution took 5 days. Mechanism of action induces the synthesis of colony-stimulating factors, stimulation of proliferation and differentiation of T and B lymphocytes, activation of neutrophils, increased resorption of damaged tissue, activation of regeneration. Indication for use: stimulation of leukopoiesis in toxic leukopenia during chemotherapy of tumors, to protect leukopoiesis during chemotherapy against the background of leukemia. Interferon and uses: Neovir. Method of application: 250 mg 5 or 6 times with an interval for 48 hours. Cycloferol. Method of application: 250 mg intramuscularly or intravenously, 5 or 7 injections with interval of 2 days. In children aged 6 or 10 mg per kilogram. Amixine. Method of application: 1 gram after meals per day 2 days, then 1 gram with an interval 2 days. For children from 7 to 14 years old, half of milligram. The mechanism of action of interferon inducers: induce the synthesis of interferons, activate bone marrow stem cells, T lymphocytes, macrophages, natural killers. Stimulates the synthesis of IgA, IgM, and IgG. Indications for use: prevention and treatment of severe forms of influenza, acute respiratory infections in persons with sign of immunodeficiency, infections caused by herpes simplex, herpes zoster, and varicella zoster, severe forms of genital infections, chronic hepatitis B, chronic hepatitis C, cytomegalovirus infection, encephalitis of herpetic etiology, severe form of acute viral hepatitis B and C, urethritis, prostatitis, cervicitis, salpingitis of chlamydial etiology, radiation immunodeficiencies, acquired immunodeficiency with inhibition of the interferon system, candidosis of the skin and mucous membranes, noroviral infections. Microbial preparations on bacterial diseases. Leukopoid. Russia. Mechanism of action: increase the number of leukocytes, increase indices of absorption, digesting activity of neutrophils, macrophages, enhance the process of processing and presentation of antigens, increase antibody production. They act on the central mechanism of thermoregulation, create a temperature optimum for the work of immunocompetent cell. Indication for use: chronic upper and lower respiratory tract infections, pustular skin lesions, herpes virus infections, chronic hepatitis B and C, protracted infections in bronchs, pneumonia, bronchitis, and tracheolitis sepsis. Polyoxidonium. Mechanism of action: increases the functional activity of tissue macrophages, blood monocytes, enhances the process of processing and presentation of antigens, increases the synthesis of antibodies, has detoxifying properties. Indication for use: local and generalized purulent septic diseases, chronic and recurrent purulent inflammatory diseases of any etiology that don't respond to traditional therapy, including recurrent herpes or genital infections. Chemo and radiation therapy of tumors, activation of regenerative process, fractures, burns, necrosis, prevention of postoperative complications in surgical patients, correction of secondary immunodeficiency arising from aging or exposure to adverse factors, stimulants of the T-cell link immunity, thymus hormones, tactivin, thymalin, thymopoietin, thymoctidine sublingually, thymogan, megarein, TP1 serono, thymwantway, thymomodulin. Mechanism of action. They have a predominant effect on the T system of immunity, increase the proliferation and differentiation of T lymphocytes, increase the number of T lymphocytes, increase the functional activity of T lymphocytes, increase the activity of T killers, normalize T-B cell interactions. Indications for use: acute and chronic viral infections, chronic persistent hepatitis, chronic active hepatitis, viral bronchopulmonary infections, viral encephalitis, hemorrhagic chickenpox, recurrent herpes simplex, viral superinfections in malignant neoplasms, chronic and sluggish infections accompanied by disorders of the T-cell link immunity, pulmonary tuberculosis, leprosy, pneumonia, chronic bronchitis, sluggish infections of the genitourinary tract, purulent inflammatory disease of the maxillofacial region. For prophylactic purpose of this surgical intervention, the radiation and chemotherapy of tumors during the period of convalescence after severe infections. Intranasal thymogen is used in the treatment and prevention of acute respiratory infections and influenza. Immunofan. It is an immunoregulatory peptide in combination with an antioxidant. Mechanism of action. Normalize the ratio of T lymphocytes to populations, restores humoral immunity, enhances the production of specific antibodies, increases the functional activity of phagocytic cells, enhances the excretion of T lymphocytes, reduces the intensity of allergic inflammation. Indications for use: respiratory viral infections, chronic viral and bacterial infections, as hepatitis, yersiniosis, brucellosis, and tuberculosis, radiation sickness, chemotherapy, drug and substance abuse, atopic and infectious allergic bronchial asthma, rheumatoid arthritis. The drug does not work well with the other immunocorrectors. Synthetic stimulants are the T-cell link of immunity. Isoprenosin. Mechanism of action. Antiviral and immunomodulatory, enhances the production of interleukins, increases hemostatic and phagocytic activity of monocytes and macrophages, increases the proliferation of T lymphocytes, T helpers, natural killers, increases the synthesis of antibodies. Indications for use: influenza and respiratory viral infections, herpes 1 and 2 types, herpes zoster, viral meningoencephalitis, human papillomavirus infection, vulgar warts, molluscum contagiosum, chronic infection accompanied by insufficiency of the T-cell link of immunity. Stimulants of the humoral link of immunity. Myelopid, bone marrow preparation. Indications for use: purulent and septic process accompanied by a decrease in the level of immunoglobulins, chronic nonspecific diseases of the lung, urinary tract occurring against the background of insufficient humoral immunity. Prevention of infectious complications in severe burns, injuries, surgical operations. Complex therapy of leukemia. Immunoglobulin preparations, replacement therapy. These drugs contain 90 or 99% of IgG. Pentaglobin Germany fortified with IgM. Immunoglobulin preparations contain a wide range of specific antimicrobial antibodies, including antiviral ones, against measles, rubella, chickenpox, influenza, poliomyelitis, mumps, hepatitis B, C, etc. Antibacterial antibodies, antistaphylococcal, antistreptococcal, antimeninges, etc. Keep Russia, the complex immunoglobulin preparation is available in tablets for internal use, in suppositories for rectal and intravaginal use. The drug contains IgA, IgM, and IgG. Contains high titers of antibodies to Shigella, Escherichia, and Salmonella. Mechanism of action of immunoglobulin preparations. Replacement therapy. Injected immunoglobulins perform the function of normal antibodies in the body. Indications for use. Primary immunodeficiency with damage to the humoral link of immunity. Severe systematic infectious disease. Septicemia of newborns. Septic shock. Infectious toxic shock in children and adults under the septic and septic PME conditions. Severe infections of the central nervous system. Severe viral infections as measles, influenza, hepatitis. Prevention of infection in premature infants with low birth weight, less than 1,500 grams and less. Deficiency of immunoglobulins in lymphocytic leukemia, AIDS, nephrotic syndrome, burn disease, severe diarrhea. There are preparations of immunoglobulins of specific action. Specific immunoglobulins are a source of ready-made antibodies to the infectious agent that caused the infectious process. Cytotoxic Germany. The drug is enriched with antibodies to cytomegalovirus. Is used for the treatment of acute cytomegalovirus infection, for the prevention and treatment of CMV in patients with immunosuppression. Antistaphylococcal immunoglobulin. Immunoglobulin measles, anti-diphtheria, anti-herpetic. Mucosal vaccines, bacterial drugs. Mucosal vaccines are drugs that are not administered parenterally, but through the mouth, aerosol or instillation. They act most actively on local immunity. They combine the properties of multi-component vaccines and non-specific immunocorrectors. Mechanism of action. Contain specific antigens of pathogens that most often cause infections of the mucous membranes and form a specific immunity to these infections. Effectively stimulate non-specific deference factors. Vaccines for the treatment of the respiratory tract. VP4. The vaccine contains antigens of Staphylococcus, Pneumococcus, Proteus, Escherichia coli. Mode of application. Ribomonil. France. The drug contains ribosomal antigens of Klebsiella, Pneumococcus, Pyogenic, Streptococcus, Haemophilus influenza. Method of application: 3 tabs on an empty stomach, 4 days in a row every week, for 3 weeks. Then 3 tablets on the empty stomach 4 days in a row to the beginning of each month, 5 months. Broncholoxone bronchomunal. Bronchomunal P. Children's Farm contains antigens of Pneumococcus, Haemophilus influenza, Neisseria, Staphylococcus aureus, Streptococcus pyogenic. Method of application: take 1 capsule orally for the first 10 days of each month, 3 months. Years 19. Dosage of inactive bacteria for intranasal administration contains 19 antigens. Method of application: in order to prevent respiratory infection of upper respiratory tract, 1 dose of the drug intranasally into each nasal passage 2 times a day for 14 days. In the acute phase of the disease, 1 dose of the drug is injected into each nasal passage 2 to 5 times a day until the symptoms of infections disappear. Mechanism of action of mucosal vaccines: increase the functional activity of phagocytic cells of local and systemic immunity, increase the amount of lysosome secretory IgA in bronchial secretions, nasal mucus, and gastrointestinal tract, increase the number of CD3, CD4, CD8 cells. Indications for use: prevention and treatment of chronic and recurrent infections and inflammatory diseases of the ENT organs, upper and lower respiratory tract. Rhinitis, sinusitis, pharyngitis, laryngitis, tracheitis, bronchitis, pneumonia. Polyvaccines for the treatment of the urinary tract. Sotrehovac, a mixture of Lyophilus lactobacillus. Method of application: a half of milliliter 3 times with an interval of 3 weeks. The vaccination is carried out once in a year. Indication for use: trichomoniasis, non-specific bacterial vaginitis. Socrovac. The composition includes inactivated Escherichia coli, Proteus, Klebsiella, Streptococcus. Indications for use: treatment of chronic and recurrent urogenital infections caused by microorganisms that are part of Socrovac.